Hello and welcome to Bristol Health Cares. I'm your host, Kurt Barwis. I am the president and CEO of Bristol Health. This program is for you. It's really about how you navigate the system of care, how you access care, and it's really about trying to answer questions you may have and really didn't know who to ask. We are going to bring to you professionals, doctors, surgeons, other healthcare professionals throughout our system of care, maybe people that you've never talked to before or met before, but the goal is to really help you understand how to access care when you need it. You're going to enjoy this program. This program is really for you. So what's important is if there is something that you want to learn about or know about or a guest that you'd like me to host on this show, write us and we'll try to make that happen for you. So enjoy the program, Bristol Health Cares. Hello everybody, this is Bristol Health Cares and I'm your host, Kurt Barwis. We have a really exciting episode today. I'm here with Christine Laprise. Christine Laprise is our Vice President of Operations throughout the system, throughout our health system. Good morning.
Good morning.
Christine, how are you? It may be actually night or evening. It could be in the middle of the night for folks that are watching. But so tell us a little bit about yourself.
Yeah, so I'm actually a Bristol resident, which has been really great working for Bristol Health. It feels really good to be working on things and initiatives that I know are going to directly impact the community that I live in. I have 3 children, 2 adult children, 1 still in high school, and a grandchild. So wow. We are loving that. Just finished my master's, so excited about that.
Really excited about that.
In legal studies, so that's been very helpful for the hospital. And so, yeah.
So you have a diverse background. Like, so when you came to Bristol Health, you didn't work in a hospital before, right?
I did not. I worked for Cigna, so I worked on the other side.
You worked on the other side.
But it gave me, honestly, a really great perspective coming into the hospital. At one point, I supported all of the physicians from an HR standpoint and all of the nurse case managers. So coming into Bristol Health, I really had that perspective of, they were no longer bedside, but always got engaged in really healthy conversations and would understand, even through interview process and bringing specifically physicians on, I knew which ones to target. I knew to go find those ones that were probably burnt out and wanted to get away from bedside. That seems to be changing quite a bit now since things have evolved and changed. We see, as you know it, physicians in our world that want to stay forever, and it's great.
Yeah. So when you came in and you made that transition, so what's the thing that kind of like struck you or surprised you the most about, now you're on the inner sanctum, you're on the other side, and you're all of a sudden interacting with, kind of like the behind the stage show of how we organize and deliver healthcare?
I think what was really surprising for me was, one of the areas I supported as well at Cigna was the contracting groups. And so you're really kind of hearing that one side of what they're trying to accomplish when they go out and negotiate those contracts with provider groups and independent physicians. And when you're on the other side of it, you see how that impacts our organization, especially ours. And I'm a bit disheartened now, right? Because I spent, those years and loved Cigna, but it's sort of sad how difficult it ends up being for an organization like ours to survive when everyone's trying to take every dollar that you can take. So that was a transition. I would say the other transition coming from a much larger organization and in the private sector coming into, in the for-profit sector coming into a nonprofit. That was, that was, you kind of come in thinking oh, well, we can do certain things. And then you got to take a step back and go, I got to research that. You know, I don't think we can do that now, you know, being a nonprofit, but.
Yeah, so a lot of people that get into healthcare do it for that connection to people and that feel of, you know, I'm making a difference. And that's what's really so unique about a nonprofit, you know, health system is it doesn't matter what you do, you get that connection. So do you feel that connection? I mean, you've been how many years now?
Almost 5.
5 years.
Yeah.
And, you know, and you've had a variety of roles. You were in HR and now you do operations. Do you feel that connection?
Oh, absolutely. Absolutely. It's, this experience has been one of the most rewarding experiences for me personally, not just because, you know, the role is great. I you know, have had an incredible, you have helped me grow, and I've taken on things, if you asked me 5 years ago that I would, you know, be overseeing an EMS organization, I would have told you were crazy. But again, kind of living in the community and knowing that if a community member comes to me and says they're struggling with something, we can immediately fix that, or we can immediately make change. And then just being frontline and center to see all of the amazing things that our docs do.
Yeah.
COVID was really eye-opening. You know, you were in the hallway with me that day when Dr. Caminiti came through.
Yeah.
And he had tears in his eyes because he felt like when COVID first started, it was for the first time he felt like he didn't have all the answers, and he was watching people die.
Yeah.
And that was an amazing feeling. And then to see the passion that those physicians took to figure this out, to help our community, and knowing I'm a part of that community is just, it's amazing.
It's very powerful, isn't it? I mean, it's almost, I say this, it's almost addictive, and it's hard to walk away from that feeling in that environment. So it's kind of interesting, you know, you would have a unique perspective about this as a relative newcomer to the organization. But so people talk about culture, people talk about, you know, what really drives people to stay in an organization or move to another organization, and they debate, you know, is it compensation? Is it this? Is it that? There's clearly something unique about Bristol Health, and there's, you know, the secret sauce. So I'm interested to hear your perspective on that, because you deal with this every day.
It's one of the reasons why when I walked through on that first interview, I was making sure I was getting that job. I've never worked in an environment where you walk down the halls and everybody says hello, and it's a feeling of genuine care. Yeah. Everyone really cares about each other. We always say this, we're like a family, and we say that at orientation, and I truly believe that. Our work family, and you know, most people go into work and, you know, their work family is just, you know, the small group that they work with every day, right? You know, most people have that experience, and they have relationships and form friendships that they have probably for the rest of their life. Ours is much larger than that. It feels like no matter whether we're walking into home care and hospice or EMS or Ingram Manor or any one of the multi-specialty groups, we all have this connection, and we know each other, and we want to see each other be successful. It's a very different environment, one that I've never been in before coming to Bristol.
Yeah. Yeah, you've said it so well. I mean, it is unique, and I struggle all the time about how, because every decision that we make, and, you know, as we add people, because it's a dynamic, it's a flowing organization, more now than ever. People come and people go, with the shortage that we have, and you know, worry and stay up at night thinking about, like, is this the right fit? Is this person the right fit? And because you're the keeper of it. You are the keeper of it, and in the areas that you have responsibility for, and it's a huge responsibility in the organization, because we all make mistakes. That happens every day.
Yeah.
And I've made mistakes where just not a good cultural fit, and and then you have to own up to that and kind of say, help that individual find the right fit for themselves. But it is the unique special thing that really holds people into the organization, and over time we get more and more of those individuals, and it grows stronger, I think.
Yeah.
So it's been a challenging time. People hear about the shortage of staffing in healthcare across this country. We had, just during the pandemic, I think it was the second year, we had over 250,000 nurses just leave the healthcare field altogether because they just didn't feel like this was something they could handle anymore. So how is it right now? What's the environment like right now?
Yeah, I think we're not back there yet. I think, and as I read statistics and data as it relates to this, it's likely going to be about 10 years before we can get back to a place, right?
Tell me no.
Yeah, I mean, it's daunting when you think about it. We're seeing this across the state. We talk with the Connecticut Hospital Association, my peers across all the hospital systems, and they're feeling it too. Unfortunately, we're all competing for the same talent, right? So, we're all friends at the table, but, if they can sneak one of our, nurses, they're going to do it. And so, we're always looking at ways we could try to be unique and ahead of the curve, and try to share as much as we can that we are different. We are that community-based hospital. I think in terms of what we're trying to do to combat some of that is stronger relationships with schools, getting out there in the community much more, doing everything we can to put the word out there that we're looking for nurses. Our community wants nurses, and our environment is different. We're a community-based hospital, and we're also a magnet hospital. So, that shared governance, and where people really have a voice and they can affect change pretty quickly. There's not a bunch of layers to kind of go up through to make change. We make change every day. We get feedback, you get feedback, and we make a change immediately if it's right for the organization. So are we still in a shortage? Absolutely. Yeah. We're starting to see a little bit of a change. Many of the organizations, including ours, had to bring on travelers, and that was very costly. And we're starting to see a little bit more of a pickup of being able to find some talent, but we've still got a lot of work to do.
It's interesting. You touched on something that I think is so important for people to understand. I was up on one of the nursing units yesterday doing a town hall meeting. Quite a few new staff members that I hadn't met before, and they asked me this question about the competitive landscape, and how every day there's a new deal and people are coming and going, and they said, well, Kurt, what is it that you think is uniquely different about our organization that is going to help people stay? And my answer was this. Here we are. Mm-hmm. We're having this conversation. Mm-hmm. I'm listening to you. Every team member listens to you, and you have a voice. And that, I think, is so important when I process what I hear from physicians and burnout and where we're going as an industry. So much of the control over their everyday decisions has been taken away from them. Mm-hmm. You have insurance companies now saying, no, you can't order this test for your patients, and it's, or you've got to fill out, 100 pieces of paper before that person gets the CT or the MRI or this procedure that they need. And the loss of control, the loss of voice, the loss of, kind of like, I'm playing a part in this very special, unique thing is I think one of the strongest components of what our organization does, it's that, and you touched on that, it is so vitally important. How about I think one of the things that's unique about Bristol Health is the way that we address inclusion and diversity. So let's talk a little bit about that.
Yeah, it's one of my areas of passion. I'm pretty proud of what we've done over the past couple of years in regards to I'm going to pull them apart a little bit and bring them back together. Related to diversity, we have a very active diversity committee. I chair that committee. What I really love about it, which is a little bit different than what I've seen in other organizations, is we're intertwined into the community. So not only are we trying to educate our own employees and bring in diverse employees, we're also educating the community. So we participate in things like Earth Day with the community, get out there and clean up some of those areas in town that are struggling to keep up with. We have a homeless population, unfortunately, and that is their home. So helping them, clean up those areas for them. And we've done quite a few different volunteering events out in the community. Internally, we do a lot of education. We've had a very successful event, White Coats for Black Lives. We are doing more in the health equity space, looking at more data. And so I'm pretty proud of where we've gone. More partnerships with diverse nursing organizations. In fact, I just sent Caitlin something this morning in regards to, partnering with a nursing organization, a Latin nursing organization. So I'm proud of that. The inclusion piece to me, and oftentimes people think they just put it together, diversity and inclusion, they put it together and don't necessarily think about, it's really two separate things that come together. As an organization, you could hire an entirely diverse population. But if you're not including them in conversations, bringing people around the table, people from different backgrounds, different races, different religions, different communities, then it's for nothing.
Right.
And so we had an incredible speaker very recently come into our organization, and it was all about inclusion. A police officer with the Naugatuck Police Department. And it was incredible to hear his story and to talk about it and talk about inclusion and how important it is. And we all know, if you read up on inclusion, that the more people you have around the table, the more diverse minds you have around the table, the better outcomes you're going to have. So we've done a lot, as you know. We've mandated some trainings and and done quite a few different things to try to get people to recognize that they need to be more inclusive. And then we've done a lot around unconscious bias. Yeah. Everybody has a bias. Right. Everyone. Your family kind of brings those on within you. You have your own thoughts and opinions, but it's about learning how to recognize that bias is there. And how do you combat that? So lots of work that we've done around that. So again, I'm pretty proud of what we've done as it relates to diversity and inclusion. Equity, kind of going back to the work that we've been doing, we are doing much more around social determinants of health. We're looking at, how we could create more of an opportunity for our patient population. We're learning that through different surveys that people are having a hard time getting to us. So how do we get to them? Yeah. So lots of work in that space, lots of looking at data and looking at how we can just support our community more and more, both from a volunteer diversity standpoint and from a health equity standpoint.
Yeah, it's a lot. You just went through a whole cadre of things that we're doing, and it feels to me like the work is never going to be done, because just as you conquer one thing, you realize there's another thing that really is so critically important. And you mentioned the data, and hospitals have tons of data. They have tons of data, and quite often, we don't inform or really kind of, I like to call it marinating in the data, not just going in and finding one point and saying, oh, that's what we're going to do, but to end up, kind of like challenging that and constantly like looking at that data from different perspectives, because, as you point out, that the whole equity, the idea, the notion of equity is that it doesn't matter who you are and what, anything about you, you should have access and you should have the same level of care and treatment as any other person. And I think that's really a big opportunity for all healthcare.
Just from a genetic makeup, right? We already know that every race has, something in their DNA makeup that predisposes them to, whether it's diabetes or whether it's, some other particular disease. To your point, I don't care what race you are, right? Because we see it in our population. It doesn't matter what race you are. We have to get them here. We have to either go to them, which we have some physicians that have gone out to Brian's Angels and have spoken to some of our homeless population to provide care, which is incredible. We've gone out to churches. We've gone out to other places in the community to really encourage people to get the care that they need, and then really learn from those conversations where they're deterred, is it transportation, is it, what is it, what's are you afraid, what is it that is stopping you from getting the care that you need to get. So and again, that's something, as you asked me earlier, how amazing is that to really to live in this community and really feel like you can make a difference for people's lives just by one small thing, but it could be life or death for them.
You almost kind of like connect all the dots, because I remember you talked about fear. We met with the NAACP group in a church, and then we had a separate meeting with them. And I asked the question, what are the barriers? And one of the key things is you have to open your mind up to understand perspective, which sometimes is hard because, you have your own feelings about it. And one of the participants said to me, because I'm afraid. And I asked the question, so you're afraid, and tell me about that. I'm afraid you're going to take my house. And that gave me such great pause. So, I mean, that to me kind of summarizes a lot of what you said, because you just don't know what you don't know until you start engaging, and you can't engage until you get to people at their place, until you get to that trust level. So tell me, any words for the future here before we wrap up? Any thoughts?
Yeah, I mean, well, this was great.
Good.
I'm excited for our future. I think we have an incredible team. We work really hard. So, I continue to be excited. Certainly, I can't go without throwing a plug out there. If looking for a position,
Absolutely.
we've got them.
We have a great family and home for you.
Yes, just go to our Bristol Health website and our careers page, and you can apply to any positions that you think you're qualified for. And
excellent.
Yeah, so
Christine, thank you so much for joining us. I really appreciate it. You're an awesome member of the team. It's just incredible. This is Bristol Health Cares, and this has been another episode. As I've said in the past, please write me at cares@bristolhospital.org with your thoughts, suggestions about what you'd like to hear in the future, who you'd like to hear me interview, and a special thanks to Nutmeg TV, the production crew, the entire program. If you get a chance, reach out and support Nutmeg. It's a great organization. They bring a lot of information to the community, and they do some incredible work. So thank you again. Have a wonderful day. Take care.